Well, good morning, and thank you very much for joining us. I am Yori Folari, and today, it's the International Youth Day, and so we'll be looking at that. The theme, by the way, this year's theme is Transforming Food Systems, Youth Innovation for Human and Planetary Health. I thought this was a very, very interesting thing, and I thought it provided an opportunity to find out how engaged our youths are. There's so many aspects to youth. Not too young to run is one aspect, but where it really, I suppose it matters there, but equally as important is how the youths engage with society. Africa is said to have the greatest population of youths of all the continents, and I guess a lot of people would sort of imagine that. So how do you define a youth? I think some say 18 to 35, but let me introduce some youths to you, professionals all, and let me start with Dr. Bodunrin Oshikomaiya. She's of the Lagos State Blood Transfusion Services. Good morning, doctor.
Good morning, sir.
Thank you very much for coming on.
Thank you very much.
Indeed. And Mr. Damiloa Balogun, well, he's a lawyer, he's a youth advocate, and he's CEO of Youth Sustainability Development Network. And, Damiloa has appeared on our program quite a number of times, and so you're welcome once again.
Thank you very much for having me.
Indeed, our pleasure. Let me pick it up from here. The extent to which you think youths are actually engaged in the movement, so to speak. Politics is important, but forget politics for now because we have a certain attitude to politics in Nigeria. We're not excluding it. We will talk about it. But on the global concerns like climate change, for instance, you can just think of all of those issues, waste disposal, and all those kind of issues. Are you saying that our youths are fully conscious of the impactful or the potentially impactful aspect of their sheer numbers? And do you think this has been harnessed?
All right, thank you very much for the question, sir. So for me, I think it's still a work in progress. And that's why we need more voices, we need more people on ground to keep advocating and keep bringing up impactful solutions that would address a lot of these problems. So in this part of this world, these things are relatively new. Mm-hmm. And so it is important because the cornerstone to achieving anything is to educate people about it. And that's why my organization, YSDC, stands to educate and also implement some great solutions that would be a very impactful way of achieving all of these goals by the United Nations, because these are actually problems disturbing not just Nigeria, but the world at large.
Indeed. And I think we're in agreement that how do you define a youth? Never mind the youth leaders of various political parties. Some of them, there are still people in their 50s claiming to be youth. As we know, you have the expression, age is nothing but a number. But I think between 20 and 35, right?
Well, something like that.
Something
I can
like
extend it to lower than 20 sometimes, like 18.
Okay.
Some places, yeah.
Sometimes about 18 to 35.
35, yeah.
Okay. Now, doctor, you're of the Lagos State Blood Transfusion Services. Yes. The role of youth, we will see the connection shortly, but you would think, hey, we're talking about sustainability of human and planetary health and all that kind of thing. So how does the youth come into this in your, shall we say, your lane?
In a lane. So first of all, the Lagos State Blood Transfusion Service, we have a mandate to provide safe blood for all that required in the state and even beyond. And one of the ways of getting safe blood is to have voluntary blood donors and to screen the blood for transfusion transmissible infectious agents. And that is where the youths come in. Mm-hmm. In Lagos State, we have about 60% of the blood donated, at least from the year 2020, that's last year, coming from the youths. So
60%?
Yes, and specifically I'm talking about the voluntarily donated blood. So
how do you measure blood? By which I mean, I'm talking about the quantity now. Do you measure it in pints or is it in gallons? I mean, do you have a target that you are looking at over a given period?
So So in the human body, blood is measured both in liters or in pints or in gallons. It just depends on what you want to use. But we do have a target of the blood that we need in the States. If we go on with the World Health Organization targets, that says that we need 1 to 2% of the blood donated from a population to meet up with the needs of that population.
1 to 2%.
Yes, that is what we need generally in any state. So if in Lagos State we still stick to the 20 million number, so that means we need at least 200,000 units of blood to meet up with the needs of Lagos State.
And how has Lagos State been doing, as you say, if you'd like, you can go before 2020, but how has it been doing in meeting the target of that 1 to 2%?
Well, we've not been meeting the targets, I must confess. Blood donation is not a culture generally in this environment, not just in Lagos, in the African setting. We do not voluntarily give blood. We have to be forced to give blood to people that need it. And that is why in the Lagos Blood Transfusion Service, we celebrate the youths. We do not force most of our youths to donate. They know the essence of donation. They realize that blood donation is a form of preventive medicine. And if you look at the theme for this year, it talks about transforming food systems for human and planetary health. So the youths understand that blood donation is a form of preventive health that will make their health actually be very, very good. So they come in to donate voluntarily.
Okay, I like where you ended there. They come in to donate voluntarily, but you said we sometimes need to force use. I wonder if you meant encourage them, because I don't think you can force anybody to donate blood.
Well, in a way, sometimes we do. Some people do force others to donate blood. For example, if there is a need for blood and there is no blood available, then even if you don't feel like doing it, you are forced to. So we encourage you to donate the blood voluntarily. It is in the blood bank. So when the need arises, nobody needs to be forced to do blood.
When you talk about forcing, I remember back in the day when we were still in the game. Let's say in Luth, for instance, and your wife was in there and was going to deliver a baby. The husbands knew that they had this duty, so come and donate blood. Is that a form of quote-unquote forcing?
Yes, a form of coercion. But it doesn't help legally now.
You don't want to use encouragement.
Well, we encourage to donate when we have the voluntary donors.
Coercion, forcing, but this is what it is. This is the fact.
Yes.
Is that what you're saying?
No, before now, because early in 2019, 2020, there was a court injunction that says you do not force any relative to donate blood before registering.
Okay.
So because that force, that coercion is gone, now we encourage the husbands to encourage. Hope you understand. So if when you are coerced to give, it's a force.
Okay.
So that's why here we encourage, we tell you, okay, donate the blood voluntarily. If you do not have a reason to give, then we encourage you, just go and give.
Encouraging, I remember again going back in the day, if you donated blood, there were some sort of programs, you leave the place with a bottle of Guinness. Either you take the bottle of Guinness there, I'm sorry to mention a brand name, there were some interesting perks that, but what?
Excuse me, any voluntary donor should be celebrated. If you give your blood voluntarily, I should celebrate you. I should give you anything we want. We encourage people. We encourage beverage companies. We encourage snack companies. We encourage people that make gifts in their companies to come and give us some of their products so we can encourage those. Yes, and they should participate. We need to encourage you and say thank you for giving blood voluntarily.
Indeed.
So it's a good thing.
Now, where there's a nexus with this is that it's all about health, planetary health, and we've said that the youths make up the bulk of our continent, and I suppose all of the innovation is really coming from the youth. Actually, when you look at it, all of the advancements. I imagine when you look at the world around you, you find that the youths are key in that, especially because of the new kind of knowledge that is that we're confronted with nowadays. People talk about people being digitally compliant or not. Perhaps more of the elders find that something of a bit of a challenge, but because the youth were born into it, they can also do a quick pickup. So the health of that particular segment is tremendously important. That's where, look, if you don't have a healthy youth, then it's not going to be very useful to you.
Yeah, that's true.
And so that's probably where there's this next about, you got to keep our youth going, things like, but when we come to other aspects that are in your lane, things like the initiatives of youths, what is it? Is it tree planting? Is it doing everything you can to sustain the planet? Is it showing a social responsibility? I've heard of so many programs where youth get themselves together, see what they can do about. Look at the around the world. There's this biodegradable mess that we are in the middle of now. Plastics have become part of our lives, and so you have some youths that are, focusing. I guess, are there areas you want to share with us that youths are sort of focusing on voluntarily?
All right. So coming from that angle, so there's plethora of youths, a lot of youths doing so many great initiatives across social problems. They're, of course, coming up with their ideas to solve social problems and environmental problems. And so one of which is the plastics you mentioned about. I was about last week, I was still at a conference where young people came up with a solution to turn plastics into bricks. So this interlocking, so they're using it. So that's actually a problem turned into a solution, and of course becomes profitable. And that's a very tremendous idea. And there are different ones. One also is using solar irrigation as a system to help farmers to promote agricultural produce. And so, most times due to climate change, we're not getting the adequate rainfall we're supposed to get. And so because a lot of farmers depend on their natural irrigation as well as using their water can to water their farmlands. So you have youth from different companies coming up with ideas where there is a solar that can power an irrigation run through pipes through their farmlands. And so through that way, they are able to water their farm without them being involved directly, and also the sun powering it. So that's a really magnificent innovation, and this is a project my organization is currently doing. And so there are a lot of youth doing a lot of great initiatives, and that's why largely, especially in Nigeria now, we need to prioritize youth. A lot of youths are doing tremendous things. For example, in South Korea, a lot of economic transformation is being led by youth. And so for us to really move globally, nationally, and then regionally, we need to carry the youths along, because after all, they make up more than half of the world population.
Yeah.
In fact, I don't know if is the number 60% in Africa, but definitely more than half.
Definitely more than half, yes.
Definitely more than half. And so you, Doctor, are concerned, there's so many angles, lanes to this, all of them converging in one point, hopefully, which is global development and global health and global sustainability. From the point of health, I understand we want we want a sustainable pool of our talent. That's an asset. The youth own tomorrow. And so from your end, in terms of helping the effort, a youth that is not healthy and therefore is not active and therefore is not able to contribute is no good. Yes. So I imagine this is where you are coming in. Tell me the different ways in which I kicked off with the only one that I know, which is concerning the happy event of delivering a new baby. But operations, having surgical operations jump to mind. Are there? What are the most important uses of blood from the blood bank?
Okay, first, let's divide it into different groups. For people that lose blood, so you can lose blood during accidents, you can lose blood during childbirth, you can lose blood during even simple home accidents like knife cuts. So we need blood to replace any blood that is lost. So for mothers, as you've mentioned, following delivery, blood is needed. Then we need blood for people that have chronic illnesses like sickle cell anemia. They need blood to sustain themselves. For people that have cancers too, they need to have blood, because during the time of the cancer and during the treatment, there's usually a reduced volume of their blood. Then we also do need blood for people that actually have issues like coagulation conditions like hemophilias. They also need a lot of blood, especially during the periods of their crisis. And finally, as I mentioned, for surgeries, during surgeries, we really cannot predict what happens. There are some surgeries that there's a more higher propensity to lose blood. So we need blood to actually sustain the lives of those people during and even after the surgery.
In terms of, since you said it's voluntary, in terms of getting blood into the blood bank, I imagine that you will be screening.
Yeah.
Is blood in, for lack of a better word, qualities? Is there a particular quality that you're looking for? Are there some instances where you say, thanks, but no thanks?
Yes. So first of all, before we even collect the blood, we do a lot of quality checks. And the first one is for the individual to answer a set of questions, which is called the donor eligibility questionnaire. If you can answer those questions correctly and there is no issue, you go on to the next stage. We check your blood pressure, we check your weight, we check your height, we check your pulse rate, and then if everything is normal and there is no problem, we check the level of the blood. So it has to a particular level before we can take that blood. So that's the first major quality check. Once the blood is collected, the blood will be observed to see what is wrong. Is the blood level low? Does it look high? Is there a different color to the plasma of the blood? And then we will screen.
Plasma is that one that looks like water?
Yes, that
because
looks like
we think of blood as red.
Yes,
but
that looks like
when
water.
you doctors handle blood, you spin it around, and then water comes to one side. So that yellowish one is the plasma.
Yellow, yes, that's the plasma. We need to look at the color of the plasma, and then we will screen for transfusion transmissible infectious agents. And that is why I really do like it when the youths are involved in blood donation, because once you screen and you are free, and we tell you that there is no HIV there is no hepatitis there is no syphilis, it encourages the youth to live a very elder life. You see the youth to tell you that, oh, they don't want multiple sexual partners. If they have to, they're actually protecting themselves. They don't share needles because they know they have to do something to sustain their health system as well as the health of the planet generally.
I'm going to come back to you on that question of the knowledge that the youth have about their own health and well-being. But in the meantime, Maazi Okoro for Inarojuku, thank you for calling in and for holding on. Go ahead now, sir.
Good morning, sir. Good morning, our doctors in the studio.
One is a doctor, the other is a lawyer, but both of them are looking to me like youth. We won't go into matters of age, not with the doctor here.
Let me just say Happy Youth Day to all Nigerian youth.
Indeed.
And today being International Youth Day, at least I was expecting programs for the youth, at least. Youth enlightenment, at least they know exactly that today is their day. They're just like Christmas or something like that.
Yes.
Now, my question to my sister in the studio, blood donor, any benefit for donating blood if one is to donate? And secondly, voluntary blood donation, which people do. But when you see people with emergency cases, they pay something like 10K or 15K, that is 10,000 or 15,000 to get this blood, which some people donated free. Why is this so in our hospital? Sure, better private or government, all these things have been happening.
Yes.
And now, there was an incident that happened. I want to find out what caused it. A young man donated blood. After donating blood, coming back to his office, he fainted. And when he fainted, they gave him bread and milk.
What's your bread? Oh dear, sorry about that.
The man is that I would have come and say. So, why did you go? He said he likes donating blood. So now, you after donating blood, you came back and you fainted. So what do we do? But the bread and milk just said that was the cheapest to give for that very spot. But I don't know. Not too very much. But God knows.
Okay, Maazi, you were ready to donate blood, but then you had a pause, right? Upon hearing that story. Okay. Okay, doctor, I sort of knew this was going to happen. I mean, blood is life, and everybody has blood, and so everybody's going to be interested in this subject.
Yes, I do agree. So Maazi actually asked 3 questions. So the first question is the benefit of blood. So I'll just roll through those answers. So the first thing is why? What do I benefit? The first, for every time you come in to donate blood, you have a health check. You don't need to go to the hospital to spend money to see the doctors, because you are going to see healthcare personnel. They will talk to you. They will ask you questions you never even talked about. You will have to answer. We are able to get a lot of health conditions when you come to donate blood. And that's why I talked to you before this program that if you have not been a regular blood donor, you really are unable to donate blood after the age of 60, because before then would have known your health condition, your health checks, understood you would have understood yourself. The second thing is that
sorry, that age you mentioned, are you saying that there is an age limit to,
there's an age limit
to when you can do whether you can donate blood or whether you will accept blood, and have you pegged it at 60?
Yes, the age limit of donating blood is between 18 years old and 65 years old.
Okay.
However, between the ages of 60 and 65, you should have been a regular blood donor. So this means if you've never donated blood in your life and you are above the age of 60 and you want to give blood, we will not collect it from you.
Okay, you will politely decline.
We will politely decline because we need you to have known, and we need to also have the knowledge of your health condition.
Quickly deal with the matter of fainting before I go back.
So when you donate blood, before donating blood, we would have counseled you on some things to do. You know, blood is a fluid. We are taking fluid from you. So before donation, we would have advised eat a healthy meal, take a lot of fluids. Don't take tea, don't take coffee, don't take alcohol. Instead, take just water and non-alcoholic beverages. So you need to take a lot of fluids.
Because these things show up in your blood, right?
Actually,
does alcohol show up in your blood?
Yes, there is, but much more than that. It causes you to be dehydrated.
Okay.
So by the time you are dehydrated and then you give blood again, there's a tendency that you feel a little bit dizzy and you might lose consciousness.
Okay.
So that would have, so we would have told you to eat a healthy meal because you also need the glucose. And then you take a lot of fluids after the donation.
Glucose is a kind of sugar, right?
Yes.
But you people say sugar is not good.
No, just food. If you take carbohydrates, then you have glucose. Doesn't mean sugar as in sugar. So once you've donated blood, you must rest for a while. You must relax for about maybe 2 to 5 minutes. If you are fine, then you start. If you are not fine, we extend it to another 10 minutes.
Okay.
After that, you must take more fluid and eat another healthy snack. So maybe
before
the
proceeding on your
out.
journey
Yes.
out. You know, I remember the COVID vaccine, when you took it, the doctors wanted you to, chill a bit.
Yes.
Just, sit down a bit. Don't just take off. But many people, they feel strong, they feel good, so they just pick up and go. Not to be advised because for the reasons you've just explained.
Yes,
sorry, Mr. Ibrahim in Kaduna. Good morning, sir. Sorry to have kept you waiting.
Good morning, sir, and good morning to your two guests over here.
Thank you.
I have listened to them very carefully. In fact, I'm so passionate to contribute to this matter because this is an issue of health.
Yes.
Am I communicating?
Yeah.
Please go ahead.
Yeah. So since it's on health issue, I really like to contribute passionately because yes, once anything that involves health is involved life, then blood donation by the youth, good and fine. I was in the village then when I donated the blood, and then the village nothing else but we are not really taking what they call some highly nutrition food. We are taking this natural food. We are only taking this natural food. Then after we taking it, now what they gave me was mouth. When I took it the following day, my body was okay. Then since then, I keep on giving anybody that goes that they need blood. I just to assist generously. So that is good. Now I really want to know, is there any implication? Give me this thing and there is nothing like giving you that much again and you go back to your old food that you normally took, usually. Like this 200. Now,
and maybe mulch wasn't part of your regime.
Another thing I really want to find out again is that you people should go down in orientation. In fact, we need a real orientate those people in the rural area because my concern is the growth in rural area because this is where I come from. So finally, please, we should also like to put some measure in place, like in our schools, markets, and some social places. Because why? This thing of blood is involved many things because you carry a lot of genetic plants. So this is what we should look into it because you had traditional. You are doing a lot. We applauded you for your wonderful contribution. But we, the masses, also is involved our lives. We also need you to orientate us so that we should know the way forward. Thank you very much. My God, Ibrahim from Kaduna. Bye.
Thank you very much, Mr. Ibrahim, for that commentary. And so when I come to you, Damilola, let's say for the moment, for the sake of this conversation, everything is going hunky-dory. We have the youth, they are healthy, they are able to, actually want to engage their potential. Now, how easy is that? A lot of youth are self-starters, but oftentimes we hear that youths want to be helped. And I don't know that we have a society that goes out of its way or leans over backwards to bring up the youth and help them and assist them. how much of a challenge is this? Youth have brilliant ideas, they have notions, but oftentimes they find themselves on their own. A bit like, what one should be careful about making the comparison, a bit like the case of women in politics, where the potential is there. We all are women, but well, I've heard it said that people are muscling them out and all of that. Yeah. But when we're talking about the youth, how is this challenge being addressed of people not wanting perhaps to help the youth as much as they should, not realizing that it's an investment in the future?
I think, first of all, it's because this part of the world is not enabling enough for youth. And so everything boils down to the fact that a lot of these youths, because as she said, the major features of youths are they're strong, they're visionary, and then they have foresight, and they're able to clearly articulate whatever they want to achieve. Because I mean, that's still that part of the lifespan. You're still agile, and you want to do a whole lot, and so you want to test and test and test and test. So majority of this thing is because a lot of people don't know, and so it comes from the fact that, of course, there is little support within the society helping youth to actually thrive in whatever they want to do. And so, especially that as a Nigerian, as an African youth, you've got to work 23 times harder. So it's just the reality of it. So if you really want to do anything, I think from my own point of view is go out of your way to do it. If it's what you believe in, make sure you do it, whether you get a support or not. If it's really worth it, at the end of the day, the hard work will pay off. And
then maybe when people now see, perhaps they'll want to key in, but the fact is youth have to be self-starters in our neck of the wood here.
That's the reality. That's the reality. It's not, I can't tell you that, okay, there are some people supporting. No, you just have to get on your feet. You have to do what you have to do by yourself. And at the end of the day, if it's worth it, it's really going to be a smooth sailing.
Doctor, coming back to you, and you said we're talking about the health of youth, and blood is one part of that. Yes, in fact, it's the health of our society, really, but youth, benefit from that. And youth are key in actually providing, because I know that's not the way you doctors express it, but their blood is sharp, as it were. As you know, as you say locally, it's sharp. Even you concede that, look, sorry, by the time you are 65, we say, thanks, but no thanks. Yes. A lot of things have been, going on. Now, in terms of the blood donation itself and the banks, how good are those banks? Do you have to throw some out, or is there an expiry time? You've stored it, you've not been able to use it, it's no more of use? What does that whole area about the currency of blood, so to speak, look like?
So I'll start from the banks. We have 119 private blood banks registered under Lagos Blood Transfusion Service, and 28 public blood banks registered under the Lagos Blood Transfusion Service. So these banks are well monitored, they are well regulated, and I can assure you that the quality of the blood that is given from those banks are very high. The second thing is that we do not have enough blood in those blood banks. So a blood bank is just an equipment. The blood bank refrigerator is an equipment inside a room that is called the blood bank. So we have the equipment, we have the infrastructure, but we do not have enough blood inside those blood banks. Talking about the expiry dates of blood, each unit of blood that is collected in the state lasts for about 35 days. And the expiry dates of blood depends on the type of anticoagulant that is used. But here we use that will last for about 35 days. So because blood is not adequate, we really have expired blood.
Okay.
So if there is expiry of any blood, it will usually be a blood product, which is the platelet concentrate that only lasts for 5 days. So blood is not enough. Expiry as in blood, we really do not have so much wastage of blood because it is not even enough for those that require.
So I suppose this is something like a call that if any youth are listening to this, or young parents, and because never mind how the youth describe themselves, there are
We're all
parents.
youths.
Well, yes, now we're all youths now.
We're all youths.
So such parents might want to encourage their youth to. Now, Ibrahim Mohammed in Damatu, Yobe State. Good morning, sir.
Hello, good morning.
Thank you for calling in, Ibrahim Mohammed in Yobe. Ibrahim, could you, are you still there? Ibrahim Mohammed. The problem here, Mohammed, if you can hear me, is that, you know, maybe you're trying to listen to yourself on your television set. Can you still hear me? I think we've gone, and we'll take a break, but don't go anywhere, please. We'll be right back. We're looking at the International Youth Day, Youth Innovation for Human and Planetary Health. Stay with us, please. Okay, welcome back. It's the International Youth Day today, and we're looking at it with Dr. Bodunrin Oshikomaiya, Lagos State Blood Transfusion Services, and Mr. Damiloa Balogun, Youth Advocate and CEO of Youth Sustainability Development Network. Let me bring in a subject that, you know, concerns the youth and that both of you are going to want to comment on. In this time of COVID-19, I noticed that at least the youth that I have spoken with, not too many of them are really keying in, and please feel free to disagree with me if you think I'm out of line there, are not engaging with it. The COVID-19 thing, it's not a youth thing, it's for the elderly. Some even go as far, not all youth, but some go as far as saying it's for the rich, it doesn't concern us. What do you think of the attitude? Because it's part of sustainability, having healthy population, healthy youth, yes, and the attitude of youth to COVID-19, especially as it regards its, one, accepting to, you know, take the vaccine, and then two, you know, complying with the protocols. Give me your personal assessment of how you think youth are doing in this regard.
All right, so with respect to youths in Nigeria that I'm familiar with, first off, to start with, someone saying COVID is for the poor, is for the rich, and then it's for the elderly ones, I think that's just pure ignorance.
Yeah,
because
of course.
The reality of it is we have young people that have contracted this virus and they're still struggling with their lives. Mm-hmm. I have like 2-3 friends, of course, abroad, and one in Nigeria that actually contracted this disease. So like speaking with them, I was able to understand that, okay, this is actually a very serious issue, and then it really doesn't know your status, it doesn't know your age, or it doesn't know anything. So anybody clearly can have COVID. And so the way youths are perceiving it in Nigeria, I mean, I just hear some people say, okay, maybe it's not the reality, mm-hmm, it's just one of those government tricks to keep us at home and all. No, but the real reality is people are actually contracting this disease.
And you know, youth, the problem is, well, I won't say the problem, the issue is youth tend to be independent. That's their very nature. That's the nature of youth. They tend to be independent. Some parents will tell you that the time comes when youth are rebellious. It's part of the normal process. But youth are going to sort of want to make their own way. I have John on the line in Abuja, is why I sort of butted in a bit, but I'll come back to you. Good morning, John in Abuja.
Good morning, Uncle Yori.
Good morning, sir. Thank you for calling in.
Good morning, sir. Please, I want to ask a question. There was a case where I was in a hospital, and somebody said there is a place we can get blood.
Mm-hmm, mm-hmm, mm-hmm.
Are you with me, Uncle Yori?
Yes, I can hear you.
Please, there was a case. I was in a hospital some time ago, and somebody is in need of blood, and a woman in the hospital directed us that there is a place we can buy blood that is meant for business.
Yes.
Please, I want to confirm, is that right?
Okay, I like that. Short and sharp. Let me bring it to the doctor. Buying and selling of blood. There are husbands, going back to my old time back in the day, who were scared to, for whatever reason, or just didn't feel bothered. And the hospital staff sort of advised that, well, if you can't do it, you know, you can buy it at a certain place. That's on the one hand. And then linked with this is the whole matter of blood touts. Maybe, doctor, you'd like to take that whole section.
Yeah, so first, we have private and public blood banks. I know I mentioned earlier that we really do not have adequate amounts of bloods in the blood banks. And so there are some private blood banks that have taken this up to ensure that there is blood, and they charged for the screening of the blood higher than what is charged in the public hospitals. So the cost of blood is not actually that you are buying or selling blood. It's actually the cost of the processing of the blood. So blood is a raw material. I collect blood from you. It is not enough.
It's not that you buy it from me.
Yes. We actually have to screen the blood for transfusion transmissible infectious agents. That is use a fourth generation ELISA technology so that we can limit the false negatives or false positives that comes with the point of care tests. So we have to screen it with the machine. We have to do a cross-matching with the blood. We have to buy the consumables. So usually the cost that people talk about is actually the cost of screening the blood to make it safe for the person that needs it, because it will be really sad for someone that is ill to take in blood and end up having some other forms of health conditions. So that is just
there are costs involved in
making blood safe.
In making blood safe, and that applies when you want to donate blood.
Yes.
But it's not, because it's not that as I was saying, a number of fathers now, I imagine, escaped, quote unquote, escaped donating blood back in the day.
Now, talking about blood touting is completely frowned upon. It is wrong. We do not encourage it. It is a crime. Because blood touts will do anything to sell their blood. So a blood tout will tell you, let me give you my blood. Let me donate my blood. Pay me some money. That is wrong. We have not even screened. We just want to collect the blood. And many blood touts, because of the financial gain, they would lie about their status. They will take so many unsupposed things to ensure that their blood is relatively higher than it should be. You are supposed to donate blood at least every 3 months, 3 to 4 months. Some blood touts will donate blood every month. They will take drugs. They will do a lot of things that are actually atrocities to ensure that they have enough blood.
And they are assuming that they're taking blood tonics.
They could take blood tonics. We know that they could take a lot of drugs. When you smoke cigarettes, your blood relatively increases for a while. So they might smoke before then. And then when the test is done, you would have a false result. So they do a lot of things that is not right.
So those quote-unquote professionals are actually reading up on what, how to manipulate the system.
Yes, to manipulate to donate blood. So we do not. We can see blood touts that are actually taking drugs, they share needles, they have multiple sexual partners, they don't have protected sex. So all those things, a blood tout will lie about it.
So you're saying this is completely frowned upon by way of answering the question. Completely frowned upon.
Do not encourage it. Do not go to blood touts. If you need to donate blood, blood is healthy. Donating blood is healthy, so donate the blood.
But when you need blood in a process, in a hospital, is there a charge that is linked to that blood that you use?
There's a charge of processing the blood to make it safe that is linked to that blood.
But it's coming from your bank, so it's already safe in your bank.
We processed it before it was in the bank.
Okay, so there will be a little exchange. As an aside, doctor, have you chosen to take the COVID-19 vaccine?
I have been vaccinated.
You have been?
I've been doubly vaccinated.
I've
had my 2 doses.
AstraZeneca, the Pfizer one.
I've had 2 doses.
Okay. Damiloa, have you chosen to be vaccinated?
Yes, I
okay, that's encouraging to hear. It's not that there are no youth, accepting the vaccines, but one does hear that a lot of them are feeling that they're okay. I'm strong. I don't have an issue with that. But as we know, even the doctors tell us that the vaccine doesn't mean that you're immune to catching it. It just means that you won't be as ill should you unfortunately catch it.
Yeah.
So that is the issue there. Again, I interrupted you because I had to go to a call. Remember when we were talking about, you said the youths have to sort of, look, let's face it, it is what it is. They have to be self-starters.
Yeah.
That's largely your experience.
Yeah.
But how easy, doesn't that limit the amount of things that youth can do? Because a lot of things have to do with research, which costs money.
Of course.
Capital, which costs money. So does this limit what youths are able to engage in and with?
All right. So for me, I think it boils down to self-purpose, trying to find what you actually want to do on a longer time. And so, as opposed to a lot of youths that think, okay, what can I get now? What can I get now?
What can I get into?
I think it's more important to try and draw up a map and see what you want to do and have a long-term thinking.
But doesn't that need a sort of mentoring? That is to say, for youth to understand, because, hey, you know, everybody has been a youth, and you're not usually as clear-headed and as clear-sighted as you are decades later. Is that a problem? Are there particular agencies that youth can subscribe to that can encourage them in the way we see nowadays, thanks to the internet and YouTube, where you see mentors and what are they called? You know, the people that just sort of encourage other people and show them ideas they didn't think of themselves.
I think, yeah, it's fine. Someone can be your role model. You need not to have met the person before. You could read books and, like you said, research. Access to information goes a long way. The quality of your life depends on the decision you make. And the decision you make depends on what you know. So it boils down to still becoming aware of yourself and, of course, learn new things. And, of course, like learn a lot and keep learning. Of course, you can have a mentor if you have to. But, of course, the YouTube is there, the internet is there. Search on something you want to learn on. And then draw out a map on a long-term goal and how you want to achieve all
Some
this.
universities nowadays, as you well know, are even training and graduating students with a mental set of becoming an employer themselves.
Yeah.
Not like going out there and writing 100 applications.
Can I even say something?
Yeah.
At the rate of which it would amaze you to understand that the rate of youth unemployment in Nigeria it can be added to be 7 country population in the world. The rate of youth unemployment in Nigeria is larger than the whole population of Kenya.
Wow.
So that means imagine a population in Kenya not doing anything. And then adding the unemployed youths in Nigeria, in some instances, would even give you 7 countries population. That's like 7 countries not doing anything.
That's scary.
So the rate at which the Nigerian system is, we need people who can actually be job creators and not job seekers anymore.
Okay. Sorry for keeping you waiting, Mr. Yusuf in Abuja. Please go ahead now.
Sorry for keeping you waiting, Mr. Yusuf in Abuja. Please go ahead now. Okay, good morning.
Good morning.
Good morning.
Go ahead quickly, please.
Happy International Youth Day.
Okay, yeah.
Please, I want to ask a question this morning.
Don't listen to yourself. Please just carry on.
Oh, okay. I want to. What is the effect of donating blood on the donor?
Dear. Oh, dear. You didn't join us early, Yusuf. We've been all over that. Okay. Since you came on late, well, the doctor has maybe just briefly, please, bullet points as to he's thinking about the effect, and I think he means the negative effect.
Negative. Well, there are very minimal negative effects to donating blood. So
and if you want to donate, there are things you should know and do before coming.
Before doing. So a few things. The pinprick, the pain of the pinprick is a negative effect. So we have to explain to you that you're going to feel a pinprick. That's it. The second thing is that you might bleed a little bit from that site after donation. You're not supposed to bleed for more than 30 seconds once the needle is removed. 30 seconds is even a lot for some people. Between 10 to 15, maximum 30, the bleeding should have stopped. The third thing is that if you do not rest well or take a lot of water, you might feel dizzy. So those are the negative effects that can actually be overcome by the advocacy, the counseling we give before you donate blood, and to ensure that you rest well and take a lot of water. Hydrate you after the donation.
So you don't donate blood today and then you're a member of a football team and there's a championship tomorrow and then you're on the field tomorrow. That's what you're saying.
Yes,
so it doesn't work like that.
Yes, it doesn't work like that. There are lots of questions. Some people will come and say that after they donate blood, you're not supposed to do anything for 24 hours. Actually, you can do a lot of things, but no strenuous activity, as you said, for the next maybe at least 12 hours. So just rest it out. You can go to the office, do some office work, documentation, administrative staff can still work, but no strenuous activities. We actually do advise some people not to even drive, especially those that do driving as a form of commercial activity for themselves. So if you are a career driver, I will tell you, oh, maybe you donate blood, maybe for the next 6 hours, don't drive, because you could feel dizzy and have an accident. So we tell you not to drive. So these are the things we actually advise about. But all those seemingly negative events are not things that are so terrible in as it is. There are things we talk to you about before you donate the blood. Like, you're going to feel the pain of the needle. When you finish, just hold up to the spot, because you're going to bleed for a few seconds, and then rest well and take a lot of water before you leave.
Because the pinpricks that you're talking about, they actually insert a needle in your vein.
Into your vein.
And it's there for the duration of the extraction,
yes.
if that is what it is called.
Yes.
Damilola, we should talk about politics as well. The part of politics in youth's engagement with their environment. We've spoken about nobody's going to hand you anything on a platter of gold.
Of course.
So you've got to make it for yourself. There are youth in politics. There are youth in politics.
Yeah,
but I imagine you're not happy with the number.
Yeah. Of course. Of course. So I think one major thing really is that, aside, this applies to anybody. Of course, we need more youths in politics, especially now that a lot of youth, of course, wants to leave Nigeria, because
that is
I really
another
don't
problem.
think that's a good way to go.
That scary statistic you gave about the unemployed youths being equal to the population of Kenya, and a lot of Nigerians are out of Nigeria, and they're usually not. People don't, at the age of 65, decide that I'm going to, try to immigrate to Canada or America or wherever it is they're going. So a lot of youths in their prime, they're out there. They call diaspora now. A wealth of a very wealthy asset, but they're out there instead of being here trying to fix it, which I know is easier to say than do, given the situation that we have. But a lot of youths are giving up and just emigrating abroad. But then there's also, happily, a number of youth, maybe in equal number, I'm not sure, who either because they can't make it or because they never even wanted that particular route, are staying here and trying to do what they can do. Are you in contact with such people who have the opportunity but are saying, no, this is where we need to be to develop it? Because even those diaspora, we're still trying to cajole, beg, encourage them to come back.
Yeah, I'm one of the persons that believe that to make Nigeria work, I'll stay here to actually put in my effort.
Okay, indeed. Mr. Kingsley in Ikorodu, good morning.
Good morning, sir.
Thank you for calling in.
Yes, sir. Please, I want to about the youth health stuff now. If you look at youth today, you discover that almost all the youth today, they are having a tattoo on them. So how would they then be able to donate blood? Almost all are you today. They are on tattoo.
That's a life choice. Okay, I imagine that's a life choice. You might not approve of tattoos, but let's ask the doctor. Do tattoos have anything to do with?
Yes.
I was in the hospital. Where I was to deliver. I discovered that all the people that entered the space they said they cannot donate because they have that tattoo on their body.
Okay, let's talk about it. Thank you for bringing that up.
Thank you very much, Mr. Kingsley. Actually, tattoos are a temporary deferral. That means if you have a tattoo, we tell you to wait for a while before you donate blood. Because you have a tattoo does not make you completely off blood donation. So we tell you to come back after 6 months.
That is if it's a fresh tattoo.
That is a fresh tattoo.
But if you've had your tattoo for the past 15 years, for example,
then you should be able to donate blood.
Or, well, you said you tell them to come back in 6 months.
6 months
It
time.
means that people who have had their tattoo for maybe 2 years, they don't have a problem.
They don't have a problem at all.
But if it's a relatively fresh tattoo.
If it's a fresh tattoo, we tell you to wait for 6 months. Sometimes we extend it to 1 year, depending on the interaction we've had with you. Because if you had a tattoo, that means you have shared a needle. The way tattoos are made, you use sharp objects to put in the ink into the skin. So we have to wait for a while.
I see.
So we tell you to come back 6 months, tell you to come back after 1 year. We'll advise you on a very good lifestyle. We'll tell you not to have another tattoo because of the implications it might cost on the person that will receive the blood. once it is maximum of a year, you should donate blood regularly. So whoever told you that with a tattoo, you cannot donate blood, had made a little mistake. We are here to change that notion.
Okay. And as I was saying, many people consider it a life choice. Yeah. And you know, it's nobody else's business, quite frankly. There are a lot of people frown at tattoos, but it's not their business. It's a
cultural thing.
It is. If people have decided, after all, we even have our own cultural tattoos.
Yes.
You know, remember? We have our own cultural tattoos that have nothing to do with Western.
My paternal grandma had a name and a birth.
Exactly. You know, so just interesting thing. You know, when we're talking about the youth here, we're just celebrating the International Youth Day, Youth Innovation for Human and Planetary Health. And so, you know, I'm delighted that you people, Dr. and Dr. Oshikomaiya and Mr. Balogun, that you decided to make time for us to come and, you know, speak about the youth, highlight them. And I suppose what we're saying is that there's a lot of hope, but there are also a lot of worries from what you've told us this morning. You in particular with that statistic about the unemployed youth in Nigeria. I hope the Minister of Employment, or, you know, I hope he's listening to all of this, you know, Minister of Labor. Now, I hope the Minister of Labor is listening to all of this, but he is an expert himself, so he probably knew all of this, and no doubt they're working about it. But we are making inroads. You know, we have youthful ministers, we have youthful governors.
Yeah,
you know, it's not all, you know, dark news.
Yeah.
There are some bright spots, but the point is, we need to call. That's what the day is all about: is to call attention
to the youth,
and how important they are. Yeah. So we're going to have to leave it here. But I want to thank you once again, Dr. Bodunrin Oshikomaiya and Mr. Damiloa Balogun. Thank you very much for coming.
Thank you very much.
Indeed. Okay, so that's our program today. Please join us tomorrow for a fresh edition. I'm Iyori Folari. Bye-bye for now.